If you get painful lumps in your armpits, your groin, your buttocks, or under your breasts, lumps that keep coming back in the same spots, sometimes the lumps may burst or drain and leave scars. Well, this video is for you. Now, you might have been told that, oh, these are just boils, or it's an infection, or, oh, if only you washed better. Well, that's probably not the case. It could actually be a condition called hidradenitis suppurativa, or HS. So let's talk about what it is, why it happens, and what actually helps. HS is a long-term inflammatory skin disease. It's not an infection, it's not contagious, and it's not caused by being unclean. So you can just sort of get rid of that thought, okay? It actually starts deep in the hair follicle. That follicle gets plugged, almost like a clogged drain, and pressure can build, the follicle can swell, and eventually it ruptures under the skin. And the immune system reacts to that spilled contents with inflammation. And that's the lump that you feel. Now, when that happens over and over and over again in the same area, the body forms tunnels under the skin. We call them sinus tracts, and these tunnels can drain fluid and pus to the surface. And over time, like thick rope-like scars can develop. 1 in 100 people worldwide have hidradenitis suppurativa. It often starts in the teens or 20s, and it tends to be more common in women. Now, in terms of what causes it, nobody has a single answer, but we know that several things can sort of pile up and stack together. Genetics. We think about 1/3 of people with HS have a family member with it. So certain genes affecting how hair follicles form are may be involved. Also, hormones usually begins after puberty, and many women notice flares around their period. Now, smoking is not great for anything, but it's also strongly linked to both getting HS and having worse HS. Also, excess weight. Excess weight in the skin folds means more friction, moisture, more body-wide inflammation, potentially. Now, let's be clear about what does not cause it. It's not caused by poor hygiene. It's not that you're not using deodorant and not shaving, not something you did wrong. And it's just really important to say because this can be a really, really tough condition emotionally, psychologically to deal with. So how do you know if you have hidradenitis suppurativa? There's a few things that doctors look at. First, what the bumps are like, deep sore lumps under the skin, some filling with pus, some opening up and draining over time, getting the tunnels under the skin and thick ropey scars. But second, where these show up, like armpits, groin, private areas, and the skin around the bottom, the buttocks, under the breasts. So anywhere like that skin rubs together. And third, the idea that these lesions keep coming back, 2 or more of these lumps in 6 months, or one that just won't go away after 3 months. Pain and the drainage and the smell and odor is a problem. A lot of people say they can feel a flare-up coming. The spot might itch or tingle or start to burn a day or two before the lump or a lump shows up. If you have HS, your doctor is going to sort your hidradenitis suppurativa into different levels based on like how much of the skin is involved, etc. This is going to be important, sort of this categorization, because this is really going to help you and your doctor determine what treatments are going to actually help you. Over my career as a physician, I have seen the treatments evolve for this condition, which is really great. The good thing is HS is treatable, and getting treated early can prevent permanent scarring, okay? A lot of people wait years before they get a diagnosis for a number of reasons, understandably, but make sure you see your doctor. So for milder disease, sometimes topical antibiotic lotions, steroid injections, oral antibiotics may be used, okay? But for moderate to severe disease, combination antibiotics can be used. Hormonal medications like spironolactone or birth control pills may help some women. And then there are biologics. These are like injectable medications that can block the specific immune signals driving hidradenitis suppurativa. There are 3 now FDA approved for HS. So that's really, really cool. And this is really a game changer, to be honest with you. More are in development as well. So please understand that there is hope. Also, surgery can have an important role as well once tunnels and scars have formed, because no medication can fully undo scarring. So what can you do? I say the first thing you do is you talk to your doctor, right? You talk to your doctor about what's really going on. But there are some lifestyle things you can do. Quit smoking if you smoke. I mean, it's one of the things that's really important. Work to maintain a healthy weight. Wear loose, breathable clothing to cut down on friction. Talk about pain control with your doctor, etc. And then also make sure that you're getting checked in general, making sure that if you have diabetes, that's under control. If you have high cholesterol and other things, that your mental health is being attended to. It's really, this condition is not just skin deep, it really can affect the entire body. So I say we want to make sure that we're looking at your whole body and making sure we're optimizing your health. HS is commonly misunderstood, but it's not your fault. And this condition is not your fault either. Make sure you see a board certified dermatologist and other specialists to help you with it. And again, we're here to help. I want you to write in the comments if this is a condition that you have or you know someone that has. Let me know. What you write may actually help someone else. Of course, this video is for general information. It's not medical advice, so talk with your own doctor about your own care. Guys, I am Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. I do daily videos and all sorts of things. Please follow my page on Facebook. Please subscribe to my channel on YouTube. Click the little bell for updates. I'm also on TikTok, Instagram, LinkedIn, WhatsApp, etc. Sign up for my free health newsletter at drjencaudle.com.